My name is Muka Chikuba-McLeod. I am the project director for the JSI implemented USAID Discover Health project in Zambia. I think for me, PEPFAR has been life-saving. We all experienced a lot of loss of life related to HIV in Zambia before PEPFAR. So many people died before PEPFAR. I think we forget where we are coming from, but we lost so many people to HIV before PEPFAR. And for me, the advent of PEPFAR, the coming of PEPFAR, was like shining a ray of hope and health on a bleak situation. Now we are at a point where we are talking about almost reaching HIV epidemic control. In Zambia, we have over 1 million people on HIV treatment, and we would have lost these 1 million people without PEPFAR. I think one of the biggest contributions that PEPFAR has had to the HIV response in Zambia, not only to HIV, to the health system, is the strengthening of our systems just across the board. Human resource investments, investments in our lab system, investments in our supply chain system, they are all stronger because of what PEPFAR has brought. Just the amount of funding that has come into the country has had spillover effects into the entire health system and helped us to strengthen our health system. And I'm hoping that as we continue this relationship with PEPFAR, as a country, our Ministry of Health and ourselves as Zambians, we can begin to pick up some of what PEPFAR has done and continue to strengthen our system so that we can make it more robust to respond to future shocks. PEPFAR has really helped us to take a look at their different needs and respond appropriately to those different needs. We have young people, for example, adolescent girls and young women who are disproportionately affected by HIV in Zambia. PEPFAR has implemented deliberate programs to safeguard these young women and adolescent girls from HIV and strengthen their resilience generally. PEPFAR has implemented the DREAMS program, and that has been a big help where it's available for preventing HIV infection among this population and making sure that they're better prepared to economically and socially to withstand HIV. PEPFAR has enabled us to respond to the specific needs of key populations like men who have sex with men, transgendered individuals, people who inject drugs, female sex workers, and their needs are different, their programming needs are different. And with PEPFAR support, we've been able to zero in to what their needs are, of course, involving them in their response, and therefore providing services. PEPFAR is helping us quietly and to the extent possible with some of the advocacy that's required to make the environment more enabling for key populations so that some of the vulnerabilities that arise from the fact that they are discriminated against, they are stigmatized, can be removed to make their lives better and more resilient to HIV.